Hi everyone, welcome back to my channel. This video is part 2 for melasma treatments that we actually do in a dermatologist's office. So if you were a patient with melasma or discoloration and you came into my office, these are the options that I would offer you. Now this is, I'm going to preface this by saying that all of us, all dermatologists, all physicians in general, medicine is an art, not an exact science. So we all have slightly different ways of treating patients with melasma, and the options that we give you are based on what we have in our own clinics, meaning like what lasers and chemical peels we have in our clinics and what we feel comfortable using. For all of my melasma patients, you are given an at-home protocol that I went over in part 1 of the video, what I usually like my patients to do. And like I mentioned in part 1, I can wave all the fairy dust on your face to get rid of melasma, but if you do not use sunscreen and you're not diligent about sun protection, none of that works. So as I mentioned in my previous video, the morning regimen that most of my patients will start using is a vitamin C serum, a tranexamic acid serum, followed by moisturizer and sunscreen. And then at nighttime is where we change things up a little bit. I usually prescribe a high-strength hydroquinone compounded prescription that sometimes also contains a little low-strength steroid cream and a little bit of low-strength retinoid. So this combination has been proven to be very effective for treating melasma. But everybody's skin is very different, and so that's why I compound these medications to your skin type. So for example, if you had really oily skin, I know that I could use a slightly higher strength of hydroquinone and a higher strength of retinoid because your skin may not get irritated as much. But if you have dry, sensitive skin, then I might just give you a little bit of hydroquinone compounded with kojic acid and vitamin C to use at nighttime, followed by lots of moisturizers. So that's why it's really nice to see board certified dermatologists, because we have all of these options that we can do. We can compound specific medications and formulations to your skin type to help treat the melasma. And like I had said before, melasma is worsened if your skin gets irritated. So we have to be very careful with the regimen that we're prescribing to you. Hydroquinone is the gold standard for any sort of discoloration and melasma. You can use all the kojic acid and licorice and this and that, but it doesn't compare to hydroquinone. It does come with this risk. So the main risk of hydroquinone is a condition called ochronosis, which is paradoxical hyperpigmentation that people get if they use very high strength hydroquinone without ever taking breaks. This is incredibly rare, and I have personally not seen it in any of my patients, but I have seen other patients who came to me with pre-developed ochronosis, and it's very tough to treat. So I'd rather just prevent it, as much as I possibly can instead of trying to treat. When you're prescribed hydroquinone, I ask you to use it about once a day for a period of 8 weeks with a pause. So after 8 weeks, your melasma should get a lot better, and then you take a break for about a month, and then you restart. This break helps to minimize any risk of ochronosis that you might get. For some patients, just a morning regimen and a nighttime regimen with hydroquinone is all that we need. But for other patients, we do have to utilize chemical peels and other in-office procedures to augment their results. And the procedures we do, it depends on patient skin type, on the budget that they have. Not everyone can afford, expensive laser treatments, and I totally get that. How prone they are to discoloration, and what kind of skin type do they have? Do they have combination skin, dry skin, oily skin, things like that? And do they have any other coexisting skin issues that they want me to address? For example, like acne scars or big pores or whatever. So all of that determines what procedure I'm going to recommend. For any patients that have very sensitive skin or that have a slightly lower budget, I actually start with a low strength chemical peel, either a Yes Nurse chemical peel or a glycolic acid chemical peel. We go very slowly because, again, I don't want to cause any irritation that can worsen melasma. So be careful if you're going to providers who do chemical peels. Not all chemical peels suit all skin colors and types. The darker skin patients, such as myself, we need lower strength chemical peels, and the name of the game is to go slowly. So I usually do a series of 4 to 6 chemical peels spread every 2 to 4 weeks. We then do maintenance treatments every 3 to 6 months, depending on how often the patient's melasma flares. This is obviously in combination with everything that I said in part 1 of the video. The second procedure that I really like doing is microneedling. Now, you've probably heard of microneedling for anti-aging or collagen building and scars. It's good for all of those things, but it's also good for melasma. Microneedling produces tiny little microscopic channels within the skin. And the nice thing is that it doesn't produce any heat. So when you don't have heat, you don't tend to worsen melasma as much compared to other lasers that also create channels within the skin but have heat, which then potentially could make melasma worse. Right after I perform the procedure and the channels are created, I then apply tranexamic acid serum so that it penetrates a little bit deeper into where the melanocytes are. This is called fractionated drug delivery. And we tend to use fractionated laser drug delivery for other things like scars or etc. But I like to do this for melasma as well, and I found that it really helps a lot. And I space out the microneedling treatments usually every 4 weeks approximately. The recovery time from the treatment is about 1 week. Initially you have some redness and then crusting, and then within 7 days you're kind of back to normal. There's not really any restrictions. And sometimes I even alternate between chemical peels and microneedling for my melasma patients, especially if they have like acne scarring or sensitivity. Then I may not want to do a chemical peel every 4 weeks. I may do chemical peel, microneedling, chemical peel, combine it with hydroquinone, etc. By the way, if you're enjoying this video and find it very informative, please hit the thumbs up button and don't forget to subscribe. My favorite laser for melasma is called Clear and Brilliant Permea. So Clear and Brilliant is what we call a non-ablative fractional laser, meaning that it doesn't take the top layer of your skin off and still creates these tiny little channels into the skin. This is one of the more expensive treatments, so I'm not going to use it for patients who have a lower budget. And it does take a treatment every 3 to 4 weeks for a series of 4 to 6 treatments to notice the difference. But I love this treatment, not just because it helps melasma, but it resurfaces the skin. So it's anti-aging, it helps with some of the fine lines around your eyelids, it helps with collagen production, even some sunspots here that people may get. They'll notice that all of that's getting better with the Clear and Brilliant. It helps to make that skin texture a lot smoother and just kind of gives you that like glowing, youthful skin. The downtime for Clear and Brilliant is also very little. I mean, people usually recover within 3 to 5 days. So you get a little bit of crusting, but you can wear makeup, you can go back to work. There's like not really any downtime. The rule of thumb usually with lasers or really any aesthetic like resurfacing treatment is that the less the downtime, the more treatments you need. Be really careful with other laser treatments like IPL or intense pulse light, which is a light-based photofacial. Most of the time, I find that people don't really know how to use this laser for melasma, or they may not even recognize that the patient has melasma. They do the treatment, IPL produces a lot of heat, and the melasma just flares with a vengeance. So while IPL is used by some people for melasma, I don't really use it on anyone that's a darker skin type. I might use it for lighter skin types, but it's not one of my top treatments for melasma. And even treatments like chemical peels, microneedling, Clear and Brilliant, all of those can actually worsen your melasma if it's not done by the right person. So whoever you see to help with your condition, you want to make sure that not only are they a board certified dermatologist, which means that they have done adequate training within the field of dermatology and are skin experts, but that they also do a lot of cosmetics and treat patients with melasma, because you only have one face. Don't sell it to Groupon. Lastly, for stubborn melasma, meaning for patients who we've tried all these other treatments for and nothing has helped, I prescribe a medication, again, called tranexamic acid. It comes in a serum and a pill form, but the pill form is obviously much more powerful. But this prescription should really be under the guidance of a dermatologist, just because it has some risks of blood clots in high-risk patients. So for example, if you smoke, if there's a personal or family history of blood clots, then I probably wouldn't prescribe this medication to you. In the dermatology field, though, we give pretty low doses for prolonged periods of time, and then you pause, see how you do, and then restart if needed. It's also used in the OB/GYN world for patients who have menorrhagia or excessive bleeding. The risk of blood clots, by the way, isn't very high, but it's good for you as the patient, as the viewer, to be knowledgeable about the risks of all of these medications that we use, but not necessarily be afraid of it. Everything comes with this, side effect profile. And so you want to be well informed, but not excessively fearful. At the end, the bearer of bad news in a way, there's not really a cure for melasma. So all of these treatments are used to help minimize the current discoloration that you have, to minimize any risk of future flares, but there's no way that we can completely get rid of it and you never get it again. you constantly have to use a lot of sun protection and some sort of maintenance treatments, whether it's with, the morning regimen that I described before, or with hydroquinone on and off, or with, chemical peels, microneedling, or clear and brilliant every few months. And despite all of these treatments, you might still get a flare once in a while, but we just treat you through it. So in my case, I haven't had a flare in a while. I use the vitamin C serum in the morning, the tranexamic acid. At night, I use hydroquinone if I really need to, but I also use a retinoid on a consistent basis, which helps a lot. You should not use a retinoid though if you have very sensitive skin, so you slowly want to start the retinoid, and I have a previous video on how to start a retinoid as a beginner. And I also do clear and brilliant treatments on myself. My last one was right before the wedding, and I really felt like it helped a lot with my under eye circles, my wrinkles, my melasma. So that's the regimen that I do. And if you have a good dermatologist and a good skincare regimen, I assure you we can control it pretty well. So if you have any questions or comments, please post below and hit the subscribe button so you don't miss out on more skincare education. And thank you for watching my video.